A seventh person is now dead from a vaping-related illness. These deaths causing the CDC to step up its investigation of e-cigarettes, while state and local governments are taking matters into their own hands. Even China getting in on it, with Juul sales reportedly being halted just a week after initial releasing them there. Joining me to discuss, a family physician in Rowan School of Orthopedic Medicine, Associate Professor Dr. Jennifer Caudle. Doctor, thanks for joining us. The CDC is activating Emergency Operations Center to deal with this. We've had the seventh person dead from this, maybe as much as 400 other cases in 30 some odd states. Just how bad is this crisis right now?
I think it's really bad, actually. And what makes it so bad is that we actually don't entirely know what the cause is and why this is happening. We're talking about the cases of acute lung injury that, as you mentioned, approximately 380 people have come down with, and 7 people have died from. This is where people who have reportedly been vaping get cough, shortness of breath, chest pain, nausea. They come down with a severe lung illness, sometimes requiring the hospital and even ventilators, and of course some people have died. But Charles, the problem here, and this is why this emergency task force is so important, the problem is we don't actually know why this is happening. We don't know if it's the e-cigarette cartridges. We don't know if it's the solution. We don't know. We don't know what it is, and that's scary.
It is scary, but okay. But vaping, although relatively new, has been around long enough that it seems odd that this is happening now. Folks in the industry are saying that it's the lower end products, that it's the people injecting certain substances in their devices themselves. That's really the reasoning here, and that there should not be an overreaction.
So a couple things to those points, and you make some really good points there, but just to clarify, first of all, we do know that most of the cases of people who have been come down with this illness have reported vaping THC or some sort of form of THC. And so the concern by the FDA and the CDC is that THC vaping products that have been purchased on the street certainly may be playing a role. It might be what people are purchasing and the composition of that liquid with THC. They're finding vitamin E acetate and some other solutions that may be contributing to the lung problems that people are seeing. But to your point of, well, wait, we've had vaping for a long time. Why are we seeing the problem now? I mean, look, we've had vaping for a long time, but I've always argued that vaping should be more regulated than it is. We've had vaping for a while, but the truth is it's not regulated by the FDA. We don't have long-term studies, and with or without the THC, and putting these cases aside, vaping and vaping solutions still have a lot of chemicals that we actually don't know the long-term consequences and effects of.
Right.
So two separate things, but they're both important.
All right, so there's a ballot initiative in November in San Francisco where they have a ban on all e-cigarettes. If this goes through, that they're allowed to ban all e-cigarettes, many are wondering if other cities and states are going to take that up. And by the way, Michigan has a new law that if a person is caught with 4 or more flavored vaping products, that they're considered a dealer of sorts, that they'd be facing some sort of criminal fine. Should we actually be talking about outlawing the product?
We should be talking about all aspects of this. And just to clarify, in California, my understanding is that, yes, they would be banned until the particular product or store shows that that vaping product is FDA approved. My understanding in California is that they need to be approved, FDA approved and regulated before they can go back on the market. That's what the ban is about. And when we talk about Michigan, for example, what we're talking about is the flavored vaping products. And I'll be honest with you, I do agree with the idea of banning flavored vaping products, except for those that have the sort of tobacco flavor.
Even for adults?
The reason why?
Even for adults?
Banned for anyone, and
Okay.
I'll tell you why. Because the people who are most affected by those flavors are not the adults. It's kids. Kids are the ones picking up those flavored products, and they're starting to vape. But remember, Charles, these kids have not been smoking, and they're not trying to quit smoking.
Sure,
they're just picking it up because they want to try what bubblegum and mango flavor tastes like.
Right.
So what these flavors may be doing is enticing a whole group of kids to take in nicotine when they wouldn't have otherwise.
We know that this is really where everyone agrees about the controversy, the crisis rather. The controversy comes in exactly on how they handled it. Dr. Caudle, thank you so much for your expertise. Always appreciate it.